Hi, welcome to today's video. I'm Mary Felling, physical therapist. Today I'm going to be showing you a couple of sleep positions that will help those of you who have back pain, neck pain, maybe some shoulder or hip problems that are preventing you from getting a good night's sleep. The idea at night when you're sleeping is to give support through the hip, the spine, the entire spine, so that's going to include the low back and the neck, and then into the shoulder. And here's how you can do that. It does mean you'll have to have a few extra pillows ready, maybe a rolled towel or two, and I'll show you how this works. So if you're a side sleeper and you have back pain or neck pain, this is for you. You want to lie on your side, and you want to make sure that your knees have a support between them. So you can either use one pillow or two pillows. How do you know how much? You want to make sure by the time you have the support between your knees that your knee and the hip are either in the same plane or the knee is higher. So right now my knee is below my hip. If I'm doing that all night, the weight of my leg is creating a strain through my hip and my low back. So I'm going to use two pillows, and what I like to do is just put two pillows in the same pillowcase, because then you're not fighting and looking around for two different pillows at night. So those are going to go between your legs, and look what I do. I get them all the way down so that my calf and ankles are supported too. So now look what's happened. My knee is higher than my hip. Great. Absolutely no strain now into my low back. Okay, that's the first thing. The next thing is getting support in the right position for your neck and your shoulder up here. So you always want to find a pillow that is as thin as you can possibly be comfortable, because the cervical spine, so the spine along your neck, needs to get support at night. And if it's too high, so if it's too thick of a pillow or too thin, your neck is either being strained down towards the bed or up towards the ceiling. So find as flat of a position, or excuse me, as flat of a pillow as you can tolerate and still feel good. And when you sleep, make sure the pillow is all the way down under your head and down to your shoulder. You don't want to be sleeping on your pillow like this, and you don't want your pillow up halfway up your head like that. It should be pulled all the way down, tucked nice in deep into your shoulder. Now for your neck, in this position, you can get kind of a little bit of a sway in the cervical spine, and people with pain in their neck, just that little bit all night can really be painful. So get one or two washcloths, and I'm going to show you how you do this. And you want to take them and roll. You want to take those washcloths, you roll them up. So here's a washcloth that's been rolled up. I've got two here and one here. And you're going to put this in your neck. Now I've tightened at both ends with rubber bands. You can use tape or something else. And I'm going to just put it along my neckline. So this is down close to my shoulder. And try this out. What you want to do is see if you feel more relief and ease in your neck if you have neck pain sleeping like this than without it. And if you do feel like you have more support and it feels better to you, then you just want to find out how thick you want it. And obviously, if one's not enough, if one washcloth isn't enough, then just keep adding the number of washcloths, roll them up, and put them in there until you feel, my neck feels good now. I feel at ease. So in this position, you want to have as much of a support into your neck that allows the neck to really relax. And so right now what I've done to my whole spine is my whole spine is nice and even. There is no strain from the weight of my legs pulling down through my hip and my low back all night, and my neck isn't in a swayed position and being strained. Following this, the next point we're going to look at is taking care of the shoulder. So for some people, they can't lie on, if I had a painful shoulder on one side, obviously you would sleep on the non-painful side. But if you're having troubles with both shoulders, you might want to try going on your low back, or excuse me, might try sleeping on your back. And if you're going to sleep on your back, you still are going to use some pillows. And the way you use the pillows here is you keep them under your knees. When you have pillows underneath your knees, it helps elongate the low back, lower it, and flatten it out. that is a restful position as far as the low back's concerned. Without the pillows, if your legs are straight, it tilts the pelvis forward, arching the back, and now the back is in a strained position all night. So on your back, you got your pillow, 1, 2, or 3, whatever's comfortable for you. You just have to kind of experiment. In this position, to help your shoulders, you would take a towel, but probably not a normal bath towel. I think I would just use a hand towel. You want to take a hand towel and fold it up, and you put it right underneath your shoulder blade. What that does is compress the shoulder blade up against the back so it's supported and it's not in this dependent hanging back position all night. So that means any inflamed muscles or tissues get a rest. They're not being strained through the evening, and because they're being compressed, that sensation of compression is much more tolerable. It feels more comfortable, and it can help override any sensation of pain while you're sleeping. If you need to, you do both of your shoulder blades, and that's probably going to be better for you than sleeping on your side. So through the night, all you're thinking about is making sure each of the main parts of the spine are supported. So right now we're making sure the low back is nice and flat. I've got my pillow all the way to my shoulders and not under my shoulders. In this position, you would not use a roll towel under your neck. You don't want to be arched like that. We had in the physical therapy world, we know there's these new pillows. They're the cervical pillows. They've been out. They're not new. They've been out for 27 years. And they have a little dent, and that's where you're supposed to sleep. But what we found is, in some cases, if you're sleeping on one of those pillows, it will end up creating TMJ, pain and dysfunction. So if you find you're comfortable with a cervical pillow, the ones with the dent in it to, support the neck forward, if you already have been using it, it's been several months, you're probably fine. But that's just a thought for those of you who are thinking about getting a cervical pillow. Just kind of watch so that if you do have TMJ symptoms starting up, that's probably not a pillow for you, and go back to a regular flatter pillow. All right, that's it for today. I hope this helps you. Thanks for joining me, and I'll see you on the next video.